Hello everybody, welcome to this presentation which is about managing your breathlessness. Breathlessness is one of the most common and distressing symptoms of patients who are experiencing lung or heart conditions. It is often described by patients as, "My chest feels tight, I feel out of breath, or I can't get enough air in." It can be classified by its speed of onset. Acute breathlessness is breathlessness that develops over minutes, hours or days. This is the type of breathlessness that you may feel on exertion or if you're having an exacerbation or flare-up of your usual symptoms. It happens quite suddenly. Chronic breathlessness is something that develops over weeks or months. It's something that many of you may well have experienced. So why do we become breathless? Disease. Unfortunately, if our lung tissue becomes damaged because of infections or environmental factors, this can result in the normal healthy lung tissue not working as it usually would, and this can lead us to feel more breathless on a daily basis. Exercise. Breathlessness is a normal response to exercise. During exercise, we feel short of breath because our body needs to deliver more oxygen to our muscles. Anxiety. When we are anxious, we tend to sit in a more tense position, and this can increase our muscle tone. As a result, we can feel more breathless. There are various techniques that can help you to control your breathlessness, including breathing re-education, positioning, and fan therapy. In the next few slides, we will discuss these. All of these techniques will hopefully help you to control your breathlessness better and enable you to carry out your daily activities more effectively. The diaphragm's role in breathing. The diaphragm is the most efficient muscle used in breathing. It's a large dome-shaped muscle located at the base of the lungs. In COPD, the diaphragm can be prevented from working effectively. Air often becomes trapped in the lungs, which pushes down on the diaphragm. Over time, this can leave the diaphragm weakened and flattened, causing it to work less efficiently. As a result, the neck and chest muscles must then work harder to maintain airflow. It is worth noting that the neck and chest muscles are not the most efficient muscles that we can use for breathing. Diaphragmatic breathing is intended to help you use the diaphragm correctly, and over time it will help to strengthen the diaphragm, decrease the work of breathing by slowing down your breathing rate, decrease the oxygen demand from the smaller, less efficient muscles of the neck and the chest, and also use less effort and energy to breathe. How do we do it? In this slide, we're going to talk to you about how you can retrain your diaphragm. It's important to remember that diaphragmatic breathing can take a little bit of practice before it feels really comfortable. So you might want to practice this technique a few times, and if you have any queries, discuss it with one of us physios or your healthcare provider. First of all, you need to be sat up in a supported, comfortable position in a chair. Place one hand on your tummy and one hand on your chest. Ideally, with diaphragmatic breathing, we like to see the hand that's resting on your tummy rise as you take a breath in and fall as you breathe out. So take a gentle breath in through your nose. This breath warms and moistens the air. As you take a breath in, the hand on your tummy should rise and your stomach should expand a little bit. There should be almost no upper chest movement. As you breathe out, the hand on your tummy should fall. It's a very subtle movement, so you might not notice it first. You need to aim for a slow, rhythmical rate, about 12 breaths per minute. 2 to 3 seconds for the breath in and 3 to 4 seconds for the breath out. So, breath in, 2, 3, breath out, 2, 3, 4. Breath in, 2, 3. As you do this, the hand on your tummy should rise slightly. And breath out, 2, 3, 4. As you breathe out, the hand on your tummy should fall slightly. Your lips should be together, your jaw relaxed, and you should breathe at a low and slow pace. As I said at the start of this slide, this may take some practice, so feel free to discuss it with us. Resting positions. The following positions are helpful when you are short of breath. They assist in relaxation of your upper chest and shoulders. Once positioned, practice diaphragmatic breathing to assist your breathing efficiency and ease the breathlessness. Resting positions. This first position is supported standing. This can be adopted at any point when you're feeling breathlessness, but is particularly useful if you're out and about and feeling breathless. Lean your weight against a wall and place your hands on the front of your thighs. This should create a slight bend at your tummy, and it should help to relax your shoulders and neck. Once in this position, think about trying your diaphragmatic breathing techniques. Alternatively, you could find something to lean through. So for example, a kitchen worktop, the back of a chair or a bench, anything where you're leaning your weight forwards. Again, we're aiming to relax your chest and shoulder and neck muscles and create a slight bend at your hips and tummy. If you've got a chair or a bench to sit on, then sit leaning forwards with your elbows putting their weight through your knees. Again, you're trying to adopt that position where you have a bend at your hips. In this position, again, you could try using your diaphragmatic breathing technique. If you're feeling particularly tired and you're struggling to sleep, some patients find that they're able to lean forwards in the forward lean sitting position with pillows underneath their heads. The pillow underneath your head will help to relax your neck muscles more, and it could help you to feel a bit less breathless. Alternatively, if you're trying to get to sleep and you're feeling very breathless, you could lie so that you've got your head supported with lots of pillows. Bend your knees and rest your upper arm across your body. This will help to rest your neck, shoulder and chest muscles and should help to provide that bend at your hips and your tummy. All of these positions can be used at any time when you're feeling breathless, and you may well find that they make a big difference.